Hello everyone, I am Dr. Satish Babu, Senior Consultant ENT Head and Neck Surgeon working in Bangalore. In certain type of earphones, especially the ones which we insert, the insert plugs we call it, those tend to push the wax deeper and deeper. So if you use the earphones regularly and the wax will keep getting pushed inside, that too it doesn't happen easily like few short weeks or anything. It takes months to build up sufficient wax to block the ear sufficiently so that your hearing goes down for you to notice it. So generally we advise to avoid insert earplugs, right? The hanging earphones are fine, or you can go for the over the headphones rather than insert plugs. Insert plugs are again harmful in a way that they keep the skin under pressure. The earphone has to fit correctly, so it has to be tightly sitting there. That means that area of the skin will get pressured and it will blanch. That means the blood supply is getting reduced. That is not good on a long term. So if you are using insert earplugs, you have more chances of earwax building up inside, and you are going to devitalize the skin. That will lead to more problems, right? It will have more dryness happening in the ear, itching, and consequently the ear block will worsen. So our suggestion is to avoid insert earplugs and go for other forms of headphones. Yes, because first of all, earwax removal by a professional is safe, but then even then, if there is for some reason, if the earwax is attached to the skin, or if the person moves while the doctor is trying to clear the ear, there can be injury. So that leads to opening up of the gate for the infection getting into the soft tissues. The other possibility is that if you had used water to flush out the wax, that again leaves a bit of moisture inside the ear, and that helps in infections in the next few days. But otherwise, just a safe removal by the ENT specialist should not lead to any infection. If you try to remove yourself, obviously you're going to hurt yourself without knowing the correct angle and how much deep you can go inside. You will hurt yourself, you will predispose to infections. If it is done by a professional under a standard setting, gently done, it doesn't cause any injuries, then it should be safe. First of all, earwax is a normal part of your body. There is no preventive measures to reduce the wax production. You need to allow the skin to produce wax so that it can protect itself, right? Little more of wax inside the ear is not going to cause harm to anybody. It's rather helpful to keep the skin moist and healthy. And earwax also has a bit of antiseptic properties, so it prevents infections. So there is no concept of wax prevention, no concept of regular cleaning for the ears, no concept of regular maintenance. The only important thing that you have to remember is no moisture is allowed inside, and they say anything less than the size of the elbow should not go into the ear. In other words, it means that you are not supposed to put anything into the ear, right? So just avoid earbuds, avoid any instruments into the ear, keep the ear dry, allow the wax to fall off naturally, don't try to manipulate it, you will end up with more problems. When there is a symptomatic earwax buildup, that means sufficient wax to fill up the ear, block the ear, the hearing goes down by 10-15% like I mentioned. Or if the person is having another ear symptom, ear pain or itching, or additional sounds inside the ear, infection, pus formation, anything like that, we will have to get it cleared to see the deeper part and properly initiate a treatment. Now, how do we go about clearing the wax? It can be as simple as just wiping it with a cotton bud, right? Or we can go for a removal with a fine instrument where we can just go behind, hook it out, right? If there is a solid wax, that's the best way. One shot, you just hook out the whole piece of the wax and then you're done with it. If the wax is softer, or if it is already like soggy by way of water going inside, or if the person has used some ear drops, it becomes a little tricky, because if it is too watery, it comes off with a suctioning. If it is too thick, it doesn't come with a suction, but we can remove it with a scoop. But if it is in between, semi-solid, you can neither suction it comfortably nor it will come out with a scoop. So that time we can use the drops soften it a little more, make it more liquidy. After a couple of days, we can try out either wash or suction clearance. Typically done under a microscopic vision or an endoscopic vision, so that when you want to injure the ear and the wax is removed completely.